Good afternoon and evening, everyone. Thanks for joining the Pleo Sanum, Sanukehls, Botanical, and Nutraceutical webinar, part 2 of the Sanum webinar with Angela Ford-Reimke and Heather Schofield. I'm Heather Schofield, and I'm a homeopath and the Medical Education Director and Medical Advisor with Biomed. I'm really excited to be talking about Sanum tonight, especially the more lesser-known remedies in this part 2 of our webinar. They are remedies that hold a huge amount of value, and they're ones that I've been using for years and ones that I've been helping to teach and discuss for years. So I'm really pleased to be able to bring this information to you tonight. And with me is...
And I'm Angela Ford-Reimke, and I'm a holistic practitioner with a focus on nutrition and exercise and training with athletes and athletic patients. And so to get sort of going into with our webinar, we are going to be covering a huge component of the Sanukehls remedies, the botanical remedies, and vitamins and minerals. And then we're going to really give you guys some protocols that you can utilize right away to help your patients and really get you familiar with these remedies, especially some of the ones that are being kind of lower on your radar or that you're not familiar with. So our hope is to bring this in the forefront and really give you applicable applications and uses for these remedies.
Okay, so categories that we're covering tonight are the Sanukehls, the botanical remedies, and the nutraceuticals, or the vitamins and minerals. So let's get started with the Sanukehls. For those of you that are not familiar with the Sanukehls or hapten therapy, this is a really interesting therapy that you can use with your patients. Very effective. It is very much part of the biological medicine approach and looking at obstacles to cure or those components that are not allowing you to help your patients move forward with their health. And so the Sanukehls then, they're basically going in and helping with old infections or inherited toxins in your patients and being able to pinpoint and help eliminate those. So then let's talk about what all of that means. So the Sanukehls, what are they? Sanukehls, they're remedies that are made from the polysaccharide extracts from cell walls of various infectious species, so for bacterial species. Now, of course, these remedies don't carry over the infectious component. It's the cell wall or the polysaccharide extract from these species. And so species include like strep and staph and salmonella and E. coli and a variety of things along that line. There's the whole reason for being able to use or how these Sanukehls work is they're addressing these microbial toxins or the leftover components of a previous infection. And these microbial toxins or the cell wall deficient microorganisms, they challenge the body and the body's immune system and the eliminatory mechanisms. And so when we're using the Sanukehls remedies, then what we're able to do is target these microbial toxins or the cell wall deficient forms and have them eliminated from the body. And so I'm going to talk about cell wall deficient forms in more detail. So what that means for a bacteria, so we're not talking about viral microorganisms or viral infections. We're talking more from the bacterial component. A cell wall deficient form, so with the bacteria and their cell wall, the cell wall has been stripped. And so whether the person has taken an antibiotic or other types of natural remedies as antibacterials, or even just the immune system and the clearing out. So if the cell wall deficient form or this bacteria has had the cell wall stripped, but it's still able to survive, then there's nothing left for the immune system to be able to see and tag in order to eliminate from the body. The other thing, too, is cell wall deficient forms, basically they're going under the radar. So whether it's bacterial or fungal, and there can be these parts of these proteins that are released from infections that also can be part of this as well. And so just as an example, if somebody were to take an antibiotic for, let's say, a strep infection, It strips the strep microorganism with the cell wall, and then you have this cell wall deficient form that now is active within the system, and the immune system's not able to recognize it. And so it's still acting as if there's an infection there, or it's creating susceptibility and taxing on the immune system to be able to clear it. So that is generally what a cell wall deficient form is. We do have books that talk about it more, so if this is something that you want to do more research about or read more about, then we do have Sanum materials that can provide more information regarding that. So now, this hapten therapy, and so Sanukehls are haptens, and Sanukehls fall under hapten therapy. They help to form these complete antigens, and so I'll talk about haptens a little bit more in just a moment. So basically with the Sanukehls then, they're working to eliminate bacterial toxins and or proteins that are released during earlier infections that were not eliminated from the body. These also can be inherited bacterial toxins as well from family lines. They work kind of like absorbers of toxins from an antigenic perspective. So with the haptens and how they work, they form these complete antigens. So you've got these haptens, which are the Sanukehls, which if you're seeing the slides right now, look like these little Lego blocks. And then they're binding on with this carrier molecule, which could be like a cell wall deficient form, or the polysaccharide extract of the cell wall or protein, and binding on, forming this complete antigen. And then this is able, these haptens, or the Sanukehl remedies, help to flag this molecule for the immune system, so then the immune system can say, oh, this is a strep microorganism, so now we know how to eliminate it from the body. So that's essentially how the Sanukehl remedies are working. One thing that is really important to mention about the Sanukehls remedies is that they're free from undesired proteins, so you don't get allergic reactions from them. They're free from lipid A, so there's no toxic effects from lipopolysaccharides or endotoxins of the gram-negative bacteria, and they also do not cause allergic or toxic fever-type reactions. So generally, they're very safe to give. They're safe to give in all ages, including children and also the elderly, and you're not stimulating the immune system with these remedies. You're just helping to detox or clear out all of this from a patient's system. Okay, and so just general applications when we're talking about Sanukehls and you want to think about how you could use them. Post-antibiotic treatment due to residual toxins, so as I gave the example of strep, all chronic disease, there's a lot of linking between chronic degenerative conditions and specific Sanukehls or suppression of symptoms. One common link is for people who have acne conglomata, so the deep scarring cystic acne that happens in teenagehood, using suppressive medications often can drive that deeper into the body. And you can see as a chronic degenerative condition, rheumatoid arthritis shows up later on in life. So there is a lot of connecting between these suppression of different bacterials and then coming into more chronic degenerative conditions down the road. So other types of uses is therapeutic blockages, so suppressive allopathic drugs, after candida infections, and we've got a really great candida protocol using the Pleo San-Cand remedy that we'll talk about. Any toxicity caused by heavy metals, neoformative processes, including benign and malignant tumors, and also never well since. So never well since strep infection or reoccurring strep infection or reoccurring anything. The Sanukehls play roles in all of those types of cases. Okay.
All right, so we're now going to go into more details and specific to available Sanukehls remedies. So as you will see with the highlighted slide, so Sanukehls canned, Sanukehls klebs, Sanukehls prot, Sanukehls staph, and Sanukehls strep. So these 5 are currently available to purchase, and they're available to have currently out of the Sanukehls list. So with that said, we're going to go into more details. So first we want to take a look at Sanukehls. And Sanukehls is a great Sanukehl because it really covers a great variety of organisms. So we're looking at fungal, yeast, and candida issues. And as Heather has stated, that these are hapten markers, so your flagging cell wall deficient form of bacteria. And so with Sanukehls, when you think about chronic candida, a yeast, and upregulated forms of this, Sanukehls is a fabulous remedy to add to any protocol that you're doing from a candida and yeast perspective. It really addresses mycotic infections anywhere in the body, spasmodic and painful colitis of the large and small intestine. So as we know that the more that we try to kill candida, the deeper it burrows into the mucous membranes. So instead of trying to kill candida, we're actually trying to downregulate this form, this pathogenic form, and Sanukehls is a great remedy to help you do so, and so that the immune system can actually start addressing the upregulated pathogenic form of candida. And so for Candida protocol.
Okay, Candida protocol. Angela and I have decided as a side note tonight that we're sharing this webinar. So, this is her second last day before she goes on maternity leave. So this is really, really quite nice to be able to, for the next year at least, do this one last webinar with her and share all this information. So, yeah, so you're going to hear us kind of pass back and forth throughout this webinar tonight. Okay, Candida protocol. So this is for candida, dysbiosis, systemic candida and fungal infections. And we do have the Candida Fix Kit that is available. It is a little bit more basic than this, so it does include an alkalizer, not Alcala, but it includes basic tab, it includes a probiotic, and it also includes the Pleo Alb drops. The one thing that's different with this, there's two components that are different when we're talking about candida and systemic candida. For those that have had a systemic long-standing candida, maybe they've used lots of different antifungal or antimycotic type herbs or remedies or prescriptions, and this candida potentially has been driven deeper into the body. They've tried the starved diets, they've tried all kinds of things and things aren't working. Then this protocol will be very effective for them. It's a very effective protocol in general, but for people who've tried lots of things and haven't been able to resolve the candida, this protocol works really well because it's all about changing the terrain. It's coming from a biological medicine perspective, and we change the terrain, we downregulate the high valence or the pathogenic candida back into its symbiotic form, and then we're supporting the body's immune system to keep things under control. This is the approach with this protocol. So we have Pleo Alcala in there, and what this is doing is it's helping to change the acid-base balance and get it better balanced, especially in the gut. It's also helping with the liver and bile, so getting the gastric juices in the gastric system and the intestinal system better balanced and also then functioning better as well. And so with the Alcala, you'd be using 1 scoop of the powder twice daily with warm water on an empty stomach. And then Pleo Alb drops, 5 drops once a day for 6 weeks. And what this is doing is helping to downregulate the Candida albicans. And then we've added in here the Pleo Sand canned. And so this is helping, again, to clear out the polysaccharide extracts, the endotoxins, and the toxins that are being left over from the pathogenic candida within the system. So this remedy is clearing out all the old from the infections ongoing and from the previous infections. And so that's 5 to 10 drops once daily for 6 weeks as well. And then a probiotic, so probiotic 7-in-1, 1 cap twice daily. That would also continue on for that 6-week period. Once the Pleo Alb is finished, then Pleo Pef is added in. Now, we talked about Pleo Alb and Pleo Pef in our Part 1 Sanum webinar, so this is where if you need more details for these remedies, you can go back into the Sanum archive and the webinar archive and to be able to listen to that webinar. And so with the Pleo-Alb, it's for Candida albicans and to downregulate that more systemic component. And then Pleo-Pef is helping to downregulate a different version of Candida. It's Candida parsilosis, and it tends to be more found on the mouth and for women more vaginally. And so this is also then peeling that second layer of the Candida back. And so once the Pleo-Alb drops are finished, then Pleo-Pef is used 5 drops once a day for up to 6 weeks. And with Candida, if the patient is also suffering from athlete's foot or nail fungus or anything along those lines, in addition, you'd want to be doing the oral protocol because this is a systemic issue. And then in addition, topically, using the Pleo-Alb ointment topically once daily or the drops topically once daily, and then also using a baking soda foot bath for 2 weeks daily to change the terrain. Okay, so then let's continue on with Pleo-Sand clubs.
All right, sand clubs. This is probably one of my favorite Sanukehl remedies in the Sanukehl line. And so sand clubs, when you think about sand clubs, you want to think about respiratory conditions, so flu, pneumonia, lung issues, antibiotic side effects. Sand clubs really shines with pneumonia. So it's a very strong supportive therapy for influenza. Pneumonia is a big one, especially for your older adults. Asthma and other lung and airway concerns and conditions, so such as bronchitis, great to use. So with use after antibiotic therapy, so we're talking about the flu vaccines and having antibiotics from having pneumonia. So this is a really good adjunct therapy to add to those patients who've had issues in the past and they are chronic and susceptible to flu. So like I stated, especially for your older patients and also for children, this is a fantastic remedy to include. All right. And so now for the pneumonia protocol. So again, with sand clubs, you can use it with a number of different modalities or therapies that you're doing for pneumonia. You're going to find that adding clubs to other therapies that you're using for pneumonia, that it's going to work that much more. So for pneumonia and upper respiratory conditions, as Heather stated, Alcala. So we're always addressing the terrain and the milieu, both intracellular and extracellular matrix. And Alcala is great for addressing the extracellular matrix and really getting that clear and getting the acid-base balance in check. And in Citro and Sanuvest are added to this because when we think about pneumonia and flu and upper respiratory, we have to look at what's happening inside the cell, not just around it, not just on the outside. So with this protocol, you're addressing both the intracellular and the extracellular matrix. So with Pleo Citro is all about the Krebs cycle. So you're looking at the mitochondria, you're looking at ATP production, and in Sanuvest, you're looking at still the mitochondria, but from a different angle. So you're reducing the lactic acid buildup and metabolic waste, and you're eliminating it out of the cell so the body, the cell, can function more optimally. So both of those, 1 teaspoon 2 to 3 times daily, and then you add the sand clubs, so 5 to 10 drops twice daily until the symptoms resolve. And you're going to see a pretty quick shift with this, especially with those that have the weaker constitution. Because it is a more gentle approach, you're going to see them shifting as well. And then we've added Udolin S, which we're actually going to go into more details with later on in the presentation. And Udolin S, or UD-S, is all about immune modulation and boosting up the immune system and supporting the immune system. So that you add 5 drops 2 to 3 times daily. And we cannot stress enough the power of vitamin C, so especially in cold and flu, pneumonia, you name it. And so we're talking about huge amounts in dosing of vitamin C to really help the immune system kickstart that, get that moving. So in this protocol, we recommend the right C powder, 1 tablespoon 2 to 3 times daily, and go up to bowel tolerance. And this protocol works beautifully to really kind of get your patients back to the point that they're feeling themselves again. And this is especially important to utilize, especially after flu vaccinations. All right.
For the vitamin C, just as a tip for the vitamin C, Harlan Lottie, he had presented a webinar back at the end of 2016, and he talked about using vitamin C with pneumonia. And so he was saying in very acute situations like that, you want to go to bowel tolerance. In this case, you may be going up to 50 grams a day, really high, because the white blood cells are essentially just drinking it up. And usually within 1 to 2 days, a pneumonia case can start to turn around and become productive. Once it's become productive, then the body's starting to discharge or excrete from an infectious immune perspective. So just as a side note, you can go very high with this, and this will help with everything, all the other Sanum remedies recommended to turn that pneumonia case around. And then just as a side note, there's a question that just came up about sending the slides. Absolutely, we're going to be sending these slides with the follow-up email and with the coupon web store $20 off offer. Okay.
Next, we have Sanprot, and this is a Sanukehl that's all about gut, viral, H. pylori. So think all your GI issues, ulcers, duodenal ulcers, peptic ulcers, ventricular ulcers, you name it. And as a secondary remedy, a supportive therapy, also Sanprot is used in herpes protocol. But the main focus that we want to look at with Sanprot is gut, viral, and H. pylori. And for some of you who are not familiar with Dr. Thomas Rao, he's pretty much, I call him the modern day biological medicine father of modern biological medicine. And Dr. Rao, in some of his protocols, Sanprot is a remedy that's included in early stages of Lyme disease. For more information is available in Dr. Rao's biological medicine book, and which is available for you to get a hold of that. And so Sanprot, where Sanprot also shines, when you think about dysbiosis, especially for infants, infant diarrhea, Sanprot works beautifully with that. Also dysbiosis after antibiotics. So it's really important to address the gut, to really clean that up, to really downregulate this pathogenic forms and let the body start repairing, let the gut start repairing. Also, another picture that you probably haven't thought about in terms of using Sanprot is lungs. So think about the lungs, the bone and circulation issues. So yes, we're talking about the gut and gastrointestinal aspect, but we're also talking about the lungs and mucous membrane, because we have mucous membranes all throughout our entire body. So Prot is addressing all of that. And on a secondary sort of level is conditions after food poisoning and colitis. So again, gut, viral, H. pylori, Prot is definitely that remedy to add for intestinal dysbiosis after treatments with antibiotic and just gastrointestinal issues in general. Prot is definitely one that you want to add into your repertoire.
Okay, so for the H. pylori protocol then, and so just understanding a little bit about H. pylori or Helicobacter, it normally occurs in the human stomach. However, infections can be a reflection of disturbed milieu and when the stomach is too acidic. And so there's evidence that shows that hyperacidity of the stomach can encourage the colonization of H. pylori. And that there's other things like nicotine and high protein, alcohol consumption can make it more aggressive and result in this tendency towards H. pylori, ulcers, and even potentially stomach cancer. And so one of the things in an H. pylori infection is to be going meat-free or following a vegan diet during that time, which can help be very alkaline. In addition, you want to be adding Alcala in for alkalizing, half a scoop in warm water on an empty stomach twice a day, and then the Pleo Sanprot drops, 5 to 10 drops once daily for 4 weeks, break for 4 weeks, and then repeat if necessary. And finally, there's one additional remedy from the Biomed line called GastroEase Plus, and this is a stomach gastritis H. pylori formula that helps heal the stomach, and then also has mastic gum in there, so it's helping to eliminate the H. pylori. Essentially, mastic gum pokes holes in the H. pylori cell wall, and therefore it can't survive. And so with GastroEase, it's 2 capsules 3 times a day with food. Okay.
All right. Next we have, excuse me, Pleo Sans Staph. And staph is all about staph infections, both acute, chronic, and recurrent infections, even if you're unable to confirm that infection diagnostically. Staph cause urogenital infections, UTI infections. This is really, really big for UTI infections. And one of the protocols that I really like with the UTI infections, we have from the Nessman line adding buco and solidago, so for your kidneys, and then adding Sans Staph to that. That combination works beautifully. So for women, especially during their menses, this is a really great remedy to add if they're susceptible to UTI infections. Sinusitis, meningitis, big remedy to use for this condition. Skin infections, folliculitis, anthrax, and this is a big one. Again, Dr. Rao, this is a remedy that he uses in anthrax protocols at Paracelsus Clinic in Switzerland. So for us to be able to have access to this remedy in Canada and the U.S. is, you know, a really fortuitous sort of remedy for us to have. And again, there is a component of pneumonia that Sans Staph addresses as well. All right, and then so the next remedy is Sans Strep. I know I stated earlier that Sanukehls is perhaps one of my favorite remedies in the Sanukehls line. That's until recently. Sans Strep is now kind of toe-to-toe with Sanukehls. So from strep perspective, you're looking at all strep infections. So this is group A and group B strep infections. And because Sans Strep really helps to downregulate these pathogenic forms of these organisms and not just, you know, flagging the cell with deficient forms of them, but it's also shifting the valent form of that as well. So strep infections, acute, chronic, recurrent, even you're unable to confirm that, Sans Strep is a beautiful, beautiful remedy. And when we look at the strep bacteria, it's an aerobic and air-tolerant and extracellular mycobacterium. So most of us have strep bacteria in our body. It just depends on the valences and the upregulation that occurs. So from an upper respiratory tract infection, tonsillitis, strep throat, chronic polyarthritis, and you wouldn't necessarily think of strep as arthritic, but when you think about our joints and our ligaments and tissues, strep bacteria also borrows into that. So that's another aspect that practitioners you need to take a look at when you have patients with different sort of systemic arthritis, crystal arthritis. So polyarthritis covers all that range. With crystal arthritis, you're looking at more of your gout patients. So strep bacteria is also a component that borrows into that. Then we want to think about skin infections and alopecia. You know, this is a component, the skin being the largest orifice, so bacteria has the opportunity to grow and upregulate. So addressing that component, strep is a really good remedy along with staph actually together. You can dose them together to help with skin infections. So we're looking at heart conditions, inflammation of the heart muscle, so endo, myo, and pericarditis. And then when we think about ear infections, strep is great because it's a remedy for, especially for infants and children, when they have ear infection, you can actually drop the strep remedy into the ear and you find that you're really able to alleviate the pain and tension that they suffer from the inflammation in the ear. All right, so for strep and staph protocols.
So for a strep and staph protocol, this one overall at this point is fairly straightforward. It's also really good for the susceptibility to infection, and remembering again, because we're talking about the Sanukehls remedies, this is also for those patients that have a tendency for reoccurrence of strep infections or reoccurrence of staph infections. It helps to reduce the susceptibility and also lower the intensity and the frequency for that patient. So for Pleo, for strep like infections, Pleo San staph drops, 5 to 10 drops once daily for 4 weeks, then take a break and then repeat as necessary. For staph-related infections or conditions related to staph, then you would be doing the same, 5 to 10 drops once daily for 4 weeks, and then break for 4 weeks. One thing we didn't talk about dosing-wise with the Sanukehls remedies, when you're first starting out, so these remedies often, they come in drops and they also come in sip or ampule forms. With the drops, they can be taken orally, but you can also rub them. And so what rubbing means is you put the drops on the skin, on usually the left inner elbow, and then you rub them on. And so if you have patients that are a little more fragile, then what you'd be wanting to do, or like constitutionally not as strong, you can start out with the rubbing of the drops, making sure that they're tolerating it, building them up. So you start with 1 drop for day 1 and then 2 drops on day 2. And then once you get to 5 drops and confirming that they're able to tolerate this, then they can start taking the drops orally. And so then for these Sanum remedies, with the San strep and the San staph specifically, if you're working with moms who are breastfeeding, then yes, these are remedies that are safe to be giving with breastfeeding mothers. It's one thing, it's always good to be confirming if they are breastfeeding, what is actually going on and what their history is and all of those things. But generally, the Pleo San strep and the Pleo San staph remedies are safe during pregnancy.
And so for group strep B, and as I was saying that San strep has become kind of a favorite remedy of mine along with Sanukehls. Being pregnant myself, I'm literally 3 weeks away, so 37 weeks, and I recently had my group strep B test done, and mine came back positive a couple of weeks ago. So the protocol with which I've been using is Pleo Citral, Pleo Sanuvis, probiotic, and adding the strep remedy into that. So after 2 weeks, and it's quite intense. So, and I'm dosing very heavy. So with the Citral and Sanuvis from the intracellular matrix, 1 tablespoon 3 times daily, probiotics 7 in 1. And I like the aspect of including the probiotics because you're also balancing the flora, the microflora, both in the gut as well as vaginally, so 2 capsules 3 times daily. And then so with strep, I've upped the dose of the strep remedy. So yes, we have the dose for 5 to 10 drops but specifically for the group strep B in pregnancy, you want to increase that to 5 to 10 drops 3 times daily. So after 2 weeks of this protocol, and then I had an additional homeopathic bacterial remedy to downregulate the bacterial load, retest, and it turns out that my test came back negative. So I highly, highly endorse adding San strep into a protocol and definitely adding Pleo Citral and Sanuvis. Probiotic, if you have access to a human strain probiotic and that you can insert vaginally, perfect, absolutely do that. But strep is the key remedy. I found that in this protocol was able to help me downregulate that group strep B so that during birthing, I won't have to have antibiotics. So Sanukehls-wise, San strep is my #1 remedy because I've experienced firsthand of what it does and how it really is able to shift and downregulate and change the bacterial load vaginally. So absolutely, I endorse San strep. So to recap on the Sanukehls, so San Pro, think H. pylori, gastric ulcer, gut viral, Sanukehls, pneumonia, influenza support. So just think about all sort of the lung, airway, antibiotic therapy, Sancant, nail fungus, used internally and topically as long as needed. So that is your yeast, your candida, and your fungal. San strep, strep infections, recurring strep throat, group strep B in pregnancy, and then Sanukehls staph, so all about staph infections, both acute, chronic, and recurrent. UTI infections, sinusitis, inflammation, skin, folliculitis. So for those of you who are familiar with the Sanukehls, once you get comfortable with using Sanukehls, those are sets of remedies that you're not going to be able to practice the same way without them. So I highly, highly recommend that you familiarize yourselves with these remedies, and which is why Heather and I are here sharing this information with you so that you do have this tool and arsenal at your disposal.
Okay, and so just before we move on to the next category of remedies, we did have one question that come in that is a very practical question. So if you're wanting to use more than one Sanukehls remedy for your patient, so let's say using Sanukehls strep and Sanukehls staph, you generally wouldn't do them, you can do them both, but not on the same day. So you would be alternating them. So you'd be doing Sanukehls strep on day 1, and then Sanukehls staph on day 2, and then Sanukehls strep on day 3, and then Sanukehls staph on day 4, and then continuing on. So just alternating back and forth until both bottles are finished. And so generally with the Sanukehls also, you can do up to 3 different ones. So then you'd be alternating every 3 days, rotating through them. And it's not really advisable to do more than 3 at a time, but with those 3, and then you can reassess and see if you need to repeat any of those ones, or you can move on if there's other ones that you think that are also necessary for that patient. Okay, so there currently is one a bacterial remedy that is available, and so with the bacterial remedy, it's Pleo UTS, and so we're going to be talking about this. I'm going to give a bit more information. Pleo UTS, it's really a very interesting remedy, and so Angela already talked about it in the pneumonia protocol, and it is a non-pathogenic bacterial remedy that's used to stimulate and support the immune system response. And so with that then, so a little bit about Pleo UTS. It's produced from the blood of the giant cold-blooded sea turtle. I'm not going to attempt to pronounce the actual Latin name. It's a resident of the Caribbean Sea. Now with this, please also understand that Sanum Germany is not going out and harvesting cold-blooded sea turtles. Once that these bacteria are originally cultured, then they continue to keep these cultures. So this was something that would have been cultured back in Dr. Underline's day, and but this was originally where it was discovered. So it's Mycobacterium flea, and this strain of this bacterial remedy is beneficial to human beings. So how it works, it absorbs fermented toxins and enzymes from other bacteria. It directly stimulates the immune system for very specific defense mechanisms to go after different bacterial infections, and then it represses pathogenic bacteria through overprotection of its own species. So it crowds out other pathogenic bacteria. And so indication-wise, it's part of the Bacillus tuberculosis group. So the different bacterial remedies that are within the Sanum remedies, they have different groups that they're part of. So this is a Bacillus species under that category. And what these do is they stimulate lymphocytes. It's very targeted for the lungs, respiratory system. So lung, extrapulmonary TB, inherited tuberculinic miasm, pneumonia, autoimmune conditions, and all chronic lung diseases and conditions of the respiratory tract. This is really where this remedy shines. It also can be used for pleuritis, meningitis, and peritonitis. It's a very strong immune modulator. It's not something that you want to use by itself. It's not something that you want to be using at the beginning of a protocol. Often this is something that you're setting the terrain and you're doing acid-base balance and you're working at boosting and strengthening the immune system, because this remedy will provoke an immune response. And so you want the patient to be able to mount an immune response, first of all, and second of all, be able to handle the mounting of the immune response. So you might be seeing fevers, you might be seeing other types of immune reactions within the patient. Historically, this remedy was used for pulmonary tuberculosis, so there definitely is that tuberculinic link, and so also then linking back to the tuberculinic miasm. Yeah, mover and shaker, as Angela says. Okay, so we've got one question that's come up here that Angela's going to answer, and then she will continue going through with the non-isopathic fungal remedies.
All right. So for the name of the homeopathic bacterial remedy, I'm going to have to get that for you guys. I don't have it on me directly, but I can have that emailed during the follow-up emails that will be going out to you all. So my apologies that I didn't actually include the names for that. All right, so next, non-isopathic fungal remedies, Pleo, Pleo muscar, and Pleo pin. So these remedies are not part of the normal symbiotic terrain within the human body. However, they are still very beneficial in downregulating the pathogenic fungal microorganisms, and which really helps to support healthier functions of their associated tissues and in issues within the body.
So Pleo, it is for respiratory or lung conditions again. So this is another lung condition remedy, and it includes things like asthma, associated night sweats, and cough. It also can be used for primary chronic polyarthritis and inflammation of the digestive organs. The species is Lariconformes officinalis, and so this remedy is produced from the fungus of this species, and popular medicine, it's used again for kind of the night sweats associated with lung disease. So it's, again, another very strong respiratory type remedy. Dosing, it's usually 5 to 10 drops 1 time a day. Okay, and then we've got Pleo muscar.
Pleo muscar. So this remedy is all about detoxification. So not just your regular detox in the sense that we think about your liver, your lungs, your kidneys, your lymphatic system. This is detox from addictive substances, so drugs, medications, toxins, cerebral and nervous overexcitement and exhaustion. So it really shines detoxing the liver, the brain, and breast from drugs and pesticides, detox from prescriptions, over-the-counter medication, recreational drugs, including steroids, and it helps to really detoxify and drain the liver and large intestine and lungs. And absolutely, it has detoxifying effects for the kidneys from past drug abuse. And so where I really like muscar as far as a protocol is the steroid sort of detox component. I work with a lot of fitness competitors and bodybuilders, and so steroid use is something that, yes, we don't talk about, but it's kind of a rampant use in that industry. So a lot of the bodybuilders that I work with, post-season, muscar is the remedy that I do administer as far as helping them to detox off of steroid use. So drugs and toxin support, including multiple chemical sensitivities. Also, clients that are hairdressers, I have a few fitness athletes that are hairdressers as well. So this also helps them to detox chemicals with all the hair dyes and the relaxers, the perms, everything that they're working with on a daily basis. And then for your everyday people, so your Tylenol poppers, your Advil users. So this is also a really good way to help detox them, opiates, marijuana, you name it. Muscar is a really fast-acting and a gentle remedy, and it does only come in ampules, so which are sips, so they can be used to sip. And for those practitioners that inject, in Germany, this is used as injectables. So for my purpose of using with athletes, I have them actually sip the remedy. So the protocol that is used for specific drug detox, and not just steroids, they could be used for OTC drugs, but from the steroid standpoint, so the protocol is Pleo alkali, so half a scoop in warm water on an empty stomach twice daily. Citra and Sanuvis. Citra and Sanuvis are always included, again, intracellular matrix, and we're trying to push all of that out of the cell, and alkali address the extracellular matrix, so helps the blood to move it through the bloodstream. And when that's happening, so you have to note that that when we think about, for example, lipoproteins are known to help transport nutrients in the bloodstream. Well, that can get congested too, and so when you're thinking about drug detox, especially from a steroid standpoint, you're going to be congesting and blocking that aspect of it, so you're really helping to push that out without Kellen really balancing the terrain with that. And then Muscar, 1 sip ampule once daily. And normally this is done for about 4 weeks from a steroid standpoint. And so it's a really good way to flush and move that out of the system. And so when this is done, then I include the Nestman Detox Kit. So this now allows, I've opened up the pathways, now allows us to detox the liver, the kidneys, and the lymphatic. So I use 20 drops of each of the remedies, Hepatica, Solidago, and Lymphodrop. And this is a beautiful, beautiful protocol that a lot of the bodybuilders and fitness competitors that I work with post-season, this is a protocol that they are always on. And they find that, you know, once the season is completed, that they're actually able to come off of their cycle of steroids without so much of damaging their GI. They don't have the gut bloating and the sort of dysbiosis. This really helps to reduce that. It's a fabulous remedy and protocol that I absolutely, you know, stand behind it 100%.
Excellent. I'm sure you could hear the enthusiasm in Angela's voice. She doesn't have to say she stands behind it because you can hear just how well it works for her and her patients. Okay, so the last remedy that we're going to talk about in this category is called Pleo Pin. And so Pleo Pin, it's a very specific remedy for the liver and for the spleen. And so with the spleen, there's not a lot of remedies out there that are targeted just for the spleen, so this makes it an extra special remedy because it is very specific with the spleen. It also can be used for cases of weakness and intermittent fever. Dosing-wise for Pleo Pin, it is 5 to 10 drops 1 time daily. And in a lot of cases with the Sanum remedies, that is the general dosing, especially in the isopathic or fungal and non-fungal remedies. Okay. So then we'll continue on. There is one question that's come up here about using the Nestman Detox Kit after a drug detox with the Sanukehls. So with the Nestman Detox, okay, so maybe we might need that question clarified a little bit. Generally, if you're doing a drug detox, you want to be addressing the liver, the kidney, the lymphatic system, and doing that heavy-duty detox all at the same time with helping the person or the patient doing the drug detoxing. And so, yes, you would take all of the Nestman remedies all in that detox kit all at the same time because you're working on the liver, the kidney, lymphatic. There's also the gallbladder and the intestinal tract that also have benefit through that kit as far as a detoxing protocol goes. And so, yes, you would take all of those together, and then you would be also, at the same time, from the drug detoxing perspective, be taking the Pleo Muscar and doing that once daily. If you're able also to work on the terrain with that patient, then Alcala and Pleo Citro and Pleo Sanavis would also be remedies you would be adding into that protocol. But specifically for drug detox, the most important 2 things are supporting your emunctories and your detox pathways with the detox kit, and then also the Pleo Muscar, which is actually physically doing that drug toxin detox support. Excellent. Okay, thank you. That was actually, sorry, just as a slide, that was really cool to see your feedback as I was answering the questions to know that everything was on track. Since we're not able to all be talking here together, then typing and communicating is the next best way. Okie dokie. So then we're going to move on to the mineral remedies. And so these are highly specialized mineral remedies. We've got 2 of them here. And so one of them is pleoselene, and the second one is pleozinc. And so pleoselene is selenium, and then pleozinc is zinc. They're in a 4x potency, and this is why these are highly specialized and very individualized remedies. In a 4x potency, and so understanding homeopathics, that's 1 to the 10 dilution done 4 times. So you still have very present physical material, molecules, physical zinc and physical selenium in there, but in that 4x potency, you've created such a situation where it's in more of a micronutrient form opposed to the macronutrient form. So these remedies do 2 things. Number 1, it allows for intracellular absorption of the zinc and the selenium, and so it is getting into the cells. And then number 2, it also enhances macronutrient zinc and selenium absorption through taking regular supplemental zinc and selenium. So these remedies really are working from that micronutrient intracellular absorption perspective. Dr. Rao at the Paracelsus Clinic, and when we're working with biological medicine, this is really where you want to get in getting stuff into the cells so that they can start to perform the functions that they need to perform. So what we're going to do then is we're going to start talking about these remedies individually. And just before that, again, there's another question that has popped up here, so I just want to answer this. So yes, the Pleo Sanum remedies and the Nesman Detox Kit can definitely be done at the same time. The Nesman Detox Kit, again, it's functioning on the detox pathways and opening them up. In some cases, you may want to be doing some of that at the beginning to open the detox pathways before you open up from like a drug detox perspective. However, you can also do it simultaneously as well. And with the SIPs, can they be taken sublingually? Yes, technically they can. So the SIPs, they are ampules. In Europe or in Germany, they use these ampules for injection. So in Europe, in Canada and North America, we talk about them as SIPs. They can be taken orally as well because they are in a liquid sterile form. And so holding them under the tongue for sublingual absorption absolutely can be done. Okay, so then let's come back to Pleo Selene.
So Pleo Selene, so when we think about selenium essentially as a trace element, its major sort of cofactor in cellular antioxidant protection, and a big component of selenium is connected with the enzyme glutathione peroxidase. So this is a major constituent of, antioxidant protection system for the cell. And so when you think about glutathione peroxidase, that's known as one of the strongest and most effective enzymes in all the body for catching free radicals. So when you have patients and individuals that are deficient in selenium, you see there's more likely an increase in toxicity of heavy metal viral load in the body, and often a more compromised or congested or weakened liver that's susceptible to oxidation and chemical influences. So selenium is definitely a trace element that is important for us to include not just in our diet, but in our day-to-day sort of happenings. And one of the things I really personally like about selenium, and recently read a research that was saying that selenium is sometimes called the viral birth control pill because it inhibits viral replication, thus reducing the viral load in the body. And also, from a standpoint of working with athletes and being an athlete myself, most athletes tend to be deficient in selenium and zinc. And so since selenium is really important for red blood cell membrane and sort of the muscle cell substructure, and it's involved in oxygen transportation and metabolism. So having sufficient amounts of selenium in the body helps and aids in enhancing aerobic sort of output and exercise performance from an athletic standpoint. So because when you think about the amount of minerals that athletes lose, not just through their sweat, but through their diet and the stressor that they put on their body, and so they're constantly oxidizing. So it's important for them to be able to replenish that. Other major uses of selenium, as we know, malnutrition and malabsorption due to deficiency, amalgam detoxification. So when we're thinking of heavy metals and amalgams, so you have patients that are getting their amalgams removed, it's important for them to supplement selenium during their heavy metal detox. You really need to help to replenish that. And this will help to decrease the toxicity of the heavy metal and the burden on the body itself.
So we want to just go quickly through a heavy metal detox protocol, and so this is using Pleo selenium, and it's important when we're doing a heavy metal detox. So when we talk about it from Biomed, we talk about using the Nesmin biorella, which is chlorella, and the Nesmin solantrix, which is cilantro. So biorella or chlorella helps to bind on to heavy metals, specifically cadmium, cadmium, mercury, and lead. The solantrix, it's a mobilizer, and it's got a big affinity with mercury as well. And so, but adding the pleoselene in there is going to be helping with supporting the heavy metal excretion and also protecting the body from the free radical damage as well. And then also, it's also very important when you're doing a heavy metal detox to remember to make sure your emunctories are open. In this case with biorella and solantrix, everything is generally moving through the gut, and so making sure bowels are moving is really important, but then also making sure that your other primary emunctories like your liver and kidneys are being protected and also being supported for excretion. Okay, and then Pleo zinc.
Oh. And Pleo zinc with selenium, I often recommend to practitioners when we're doing protocols and that involve Pleo zinc and or selenium, I often will advise them to take selenium together with zinc, because when we think about it, once the body is deficient on one trace mineral, you're going to find a deficiency in the other one because they tend to piggyback and ride with each other quite closely. So zinc, my apologies, plays an essential role in various biochemical pathways, organ systems, including just gastrointestinal, central nervous system, immune musculoskeletal, you name it. It has a huge role that it plays in our body. So it's really important for us to keep our zinc levels optimal. And because when we're deficient, there often dysfunctions in both the humoral and cell-mediated immunity, and not just immunity, but also the body's, it allows the body to be able to absorb nutrients properly. And as I was saying with lipoproteins before, this is also a component that really applies to that. So both zinc and selenium. And zinc, from a wound healing perspective, it really allows the body to turn over that healing process much faster. And when we think about dysbiosis, pancreatitis, diabetes mellitus, zinc is an element that has to be addressed when you're looking at these conditions and issues. So zinc has a number of different uses, and Pleo zinc is unique. So it's not just your regular zinc remedy, because we are looking at the biological medicine perspective and we're looking at the cell itself and the terrain. So these remedies are going right into the cell matrix. So you're actually addressing how the body is able to metabolize, and from a very cellular component. That's why the Pleo zinc and Pleo selenium together work beautifully from an intracellular perspective. So it's important to pair those together. And again, from an athletic component, most endurance athletes tend to be deficient in zinc as well as selenium. And so from an endurance athlete component, especially because it's a high production, endurance athletes who tend to adopt a diet that's high in carbohydrates and lower in fats and protein tend to be more deficient in zinc and in selenium. So it's important to increase their zinc intake and the selenium intake. So you'll find they tend to have thinner hair, they tend to be a lot more slender, not just because of the energy expenditure, but their body is over-metabolizing minerals which their bodies, their bones and hair and skin need to be utilized. So it's important to definitely be aware of that for both zinc and selenium. All right, and because selenium is a huge part when you think, zinc, both. Zinc and selenium are really huge components and remedies to include and to take a look at, especially with diabetic patients. So with pregnancy, gestational diabetes, often when you have pregnant women that test positive or they have gestational diabetes, you'll find that they're deficient in zinc and in selenium. So one of our protocol for gestational diabetes is Pleo's zinc, 10 drops twice daily, with Pleo 10 drops twice daily, and then Buco and or Solidago. The reason that these remedies are in there is you're looking at the kidney support, so the pancreas, in relation to diabetes and gestational or otherwise, it's really important to address that. So adding selenium and zinc to kidney support and then really addressing the intracellular matrix, you find that this protocol really will help your pregnant women to reduce their chances of gestational diabetes. And so Buco or Solidago, you're adding 12 drops twice daily in water. And again, as Heather stated earlier, that you can mix the Pleo Sanum remedies along with the Nesman Pharma remedies. All right. So we're going to shift gears, and we're going to be taking a look at botanical remedies. So we have about these 5 botanical remedies are sort of ones that I've said to Heather in the past that these are a little bit under the radar, but they work beautifully, and they're unique and specialized botanical remedies. You know, the biological medicine, when you look at botanical remedies, have done a really great job in formulating these remedies in ways that actually work with each of our cellular matrix. So whether you have somebody who's more congested or not, these potencies adjust to each of our sort of matrix, if you will. So we're going to be taking a look at Pleo cereve, ginkgo. So with cereve, cereve is all about elimination of heavy metals. So it promotes circulation in the mucous membranes and metabolic waste. Upper GI, and great thing is these remedies pair really well with the Sanukehls as well. So cereve, respiratory system disease, huge remedy to use for that. So when you're thinking of in terms of elimination of heavy metals, this really aids in repairing the GI tract because it helps to increase the circulation to the mucosa. So from that aspect, you're pulling out the heavy metal, but you also have to be repairing or keep in mind that you need to help to repair the mucous membrane. So cereve does both. Not only does it promote the circulation, but it also helps in repair because it does have a mild antibiotic action in that sense. So it really does play a key role in helping to repair the GI by increasing the circulation to the mucosa.
Okay, so next we're going to move on to Pleo ginkgo. And so this is a ginkgo biloba in a 1X form, and in the drops, and then in the ampules, it's in a 4X form. And so Pleo ginkgo, it's been known for thousands and thousands of years, and it's used for circulation and helping to eliminate toxins or toxic burdens. Great in geriatric patients, increasing circulation, whether it's arterial or peripheral in the body, and atherosclerosis in cases of needing more circulation to the brain, Alzheimer's and dementia, and stroke, and then also just in general kind of a weakness in concentration or tiredness. Okay, and so then we also have, this isn't necessarily like a big broad spectrum circulation protocol, but this protocol, there's 2 products here that can really improve macro and micro circulation in within the body. So the Pleo ginkgo drops, 15 drops 3 to 5 times a day. And then in addition, self-tonic, which is very specifically a circulation formula focusing on macro circulation throughout the body, that would be 1 capsule 3 times a day.
All right, Pleo oku, another fantastic Sanum remedy. Pleo oku is all about food poisoning, traveler's diarrhea, acute diarrhea, digestive issues, overindulgence, and Pleo oku is actually derived from a West African bark, and a lot of West Africans tend to use the bark. It's boiled and then pulverized and then made into a tonic and is used as a sort of a detox agent. And myself being Nigerian, West African, I remember as a child, my grandmother used to have us drink this bitter bitter tincture and from the West African bark called okubaka. And so we used to literally suck on, she would boil the bark and we'd suck on it, and then we'd have to drink the tonic. So anytime that we had, you know, sort of gastrointestinal issues or worms, that was the remedy that we used to drink. And to think about that, it's now made into capsules. I wish I knew that back then. It'd be so much easier to take. And so Pleo Oku works beautifully. So not to say to encourage your patients to overindulge, but for those patients with overindulgence in both food and alcohol, Pleo Oku is a really great remedy to help hold that and really help to settle the stomach. So when we think about digestive support and elimination of metabolic waste, Pleo Oku, that is the remedy for you. And in some aspects, in some cases, can be used for some forms of parasite, not all, but some from a food intolerance sort of perspective. And so there's a number of ways to actually dose Pleo Oku. So when we're thinking of Oku from a diarrhea standpoint, and I'm talking about traveler's diarrhea and food poisoning, there's a couple of ways you can dose that. So when we're looking at from an acute picture, so you're taking 5 drops or 1 tablet, and it's better to dissolve this sublingually under the tongue. So from the acute standpoint, 30 to 60 minutes, you're taking 5 drops or 1 tablet every 30 to 60 minutes until symptom subsides. And you'll find within a day that that actually does happen. I had my wedding in Mexico, and half my wedding party had food poisoning, and thank goodness that I had brought a few boxes of Pleo Oku, and literally I was handing each sleeves of Pleo Oku tablets to them, and by the end of the night, that was halted. So I was very, very fortunate to have that on hand. And so from a preventative standpoint, you can take 5 drops or 2 tablets dissolved under the tongue twice daily. And for overindulgence, so when you've drank too much, you've eaten too much, not necessarily that you have food poisoning, but you've just eaten too much, 10 drops or 1 to 2 tablets dissolved. And then, so for the patients that are actually getting ready to go on a tropical trip or somewhere in Mexico or the Caribbean, so practitioners, you can actually have them dose Pleo Oku preventatively. So about 3 to 5 days out before they're to leave for their trip, have them take 1 tablet daily as a maintenance and as a preventative sort of action, and to do that throughout the entire trip. So it would actually help them, stop them from getting traveler's diarrhea or getting food poisoning, and it works really quite well to help settle and keep the stomach settled. All right. Now we have Relevora. Relevora is all about supporting the immune system. So it's part of a cold and flu upper respiratory tract remedy that works to really help to stimulate the immune system and really look at sort of fevers and coughs and bronchitis. And where Relevora really shines is for that deep, hard, dry whooping cough, Relevora really works because it gets deep into the lungs and helps to break up mucous membrane. It really helps to break up the cough. So for children that have that deep whooping cough, Relevora is a great remedy because it really helps to sort of subside that. And the ingredients speak for themselves. Drosera, Echinacea, Joglins, those really have a huge effect on the defensive capacities in feverish process and conditions. So it's a great combination of a long proven effective substances with these 3 ingredients. And so for dosing, for oral intake, so for acute conditions, we're looking at 15 drops every 2 hours up to 6 times daily. And then in cases of chronic conditions, you want to up your dosing, so 20 to 25 drops 3 times daily. And you really don't want to use this remedy more than 8 weeks, depending on the advice of yourselves as practitioners and physicians. But you'll find that you won't have to be on that remedy for a very long time. It's usually quite fast-acting. Within several days, you'll start noticing huge changes and whooping coughs and dry coughs really subsiding. All right. So next is Usnea. Usnea is one of those remedies I was saying to my colleague Heather that Usnea is a remedy that is sort of an under-the-radar type remedy, in that we think of usnea as just a remedy mostly for sunstroke and headaches, or headaches associated with sunstroke, heat stroke, and migraine. However, usnea has a huge, huge other element and component of it that it's a beautiful remedy, though it's sort of under the radar. From an elimination aspect, can be used with heavy metal protocols and metabolism. But the angle that I'm referring to as far as usnea being one of these under the radar but beautiful remedies is the connection to migraines and gallbladder disorders. And so with that said, Heather is actually going to go into more details with you in regards to the connection to the meridian points with migraines and gallbladder, and how usnea is a really key remedy to consider in such situation.
Okay, so with usnea, applications with the head, and headaches being the really big aspect of it, there is a gallbladder headache connection. And so for those types of headaches that are associated with that knocking, bursting, stabbing sensation in the temple region or just above the eyeball, and then also having a lot of pressure or pain behind the eyes, and then pain that can circulate at the back of the head, this is an indication along the gallbladder meridian, and so it's showing the headache and gallbladder connection. So in addition to focusing maybe on some gallbladder drainage or some acupuncture points along the gallbladder meridian, the one thing to also remember is about the Pleo usnea. And so for acute headaches that have, again, those like stabbing, knocking, bursting type sensations, then you would be wanting to use 5 drops 6 times a day, or up to 6 times a day. And then for more of a chronic headache that can come and go, sinus headaches that can come and go, then that would be 5 drops 1 to 3 times daily. And so with that last protocol is also the last slide. So thank you, everyone. Thank you so much for joining on to the webinar tonight and learning about the Sanukehls, the mineral remedies, and also the botanicals within the Sanum line.
And also we want you all to remember that some of these remedies that you may not be familiar with, and so we highly encourage you to definitely take a look at them, because they're clinical pearls and gold pieces that you can add to your practice that you would not have thought to consider before, because these are fabulous remedies that work quite well for different conditions, different situations, that from a biological medicine standpoint, this is what we're here for, to really kind of think outside the box and use those remedies to be able to help our patients to be the best that they can be, and you as a practitioner yourself.
Yes, exactly. First question is there any contraindications with using Pleo ginkgo and blood thinners? And so for that, I have the Materia Medica right here in front of me. So let's see, contraindications, no contraindications, there is no interactions, and there's no precautions with blood thinners. There is, however, with the ginkgo drops, the product does contain 50% alcohol, and so there is the caution with liver disease and alcoholism, pregnancy, and in children. But you can also dilute the remedy down or dilute the alcohol off. So as far as contraindications with blood thinners, no, Pleo ginkgo can be used in combination with blood thinners. Also, self-tonic, the remedy I mentioned in the circulation protocol, it's also safe to be using with blood thinners as well. Okay, so another question is about test kits. Yes, we do have test kits. There is a Sanum test kit that is available. It is $125 for the test kit, and it contains every single remedy and all the potencies that they exist in. And when you use potencies, this question is a little bit more complex because it depends on the remedies. The remedies in the Sanum line range anywhere from 2x to 7x. And so it depends. Often the drops are a certain potency, ampules are another potency, capsules or tablets or other potencies. Generally, though, the lower the potency, so the 2x would be stronger, and the 7X would be weaker. And so that would be, we do have a document that gives suggestions on when to use different types of potencies, but it really also depends on what the remedy is that you're using. So that question isn't so much of a straightforward answer. Okay, and so for Relevora, for the length of time, it can be used up to 8 weeks. And so in acute situations, you would be using it until symptoms resolve. In a chronic situation, you can use it up to that 8 weeks, give a break, and just see how things go with that patient. Okay, and
so the question about directions with the Sanum test kit, there aren't directions specifically with the Sanum test kit. However, we do have the Materia Medica available, so that can be sent with the Sanum test kit complimentary. So we would include the Materia Medica at no charge to you.
Yes. And then we also have lots of resources for Sanum training. And there is an online course that you can watch. And in that course, then it also gives indications and directions on how to use it. When you're using a test kit, you're going to be using it with some sort of testing device, some sort of EAV testing device if you have one. You can also use it with the REBA device that we have here, or you can straight muscle test or applied kinesiology techniques to see what the patient needs. So as far as the testing goes, it's fairly standard as far as some sort of applied kinesiology or EAV testing, but to know which remedies, when to use them, that becomes a bigger question and needing often further training and references and learning how to use them. But once you learn how to use them, then you know how to use them. And so then that's when you can, get creative and outside of the box as well. Okay. So another question here about what would you use for blood in the urine. That is a bigger question. If there's blood in the urine, that would be indicating that there is bleeding somewhere, and that's something that definitely needs to be investigated. There isn't a specific remedy in the Sanum line that would be used for blood in the urine. One of the first questions I would have would be, does this patient have a urinary tract infection, a bladder infection, a kidney infection, and if so, why? Is there some sort of bacterial involvement or what it would be? So those are the first things to be investigating. You may want to consider using something like Solidago. However, determining what the actual cause is for the blood would be the thing that's the first and most important to make sure that this is not a more urgent or emergency type situation. Okay, and then another question regarding test kits. So we have test kits for all 5 product lines that Biomed carries. So there is a Sanum test kit, there's a Biomed supplement nutraceutical test kit, there's a test kit available for the Nessman Pharma remedies, there's a test kit available for the Rubimed remedies, and then we also have the 4 food nutrient series remedies. So there's a mini test kit that's also available for that. So, okay. So again, coming back to the question about the blood in the urine and checking for source. So treatment-wise, if it's a bacterial involvement, then you would want to be using something from an antibacterial perspective. Again, as I mentioned before, in the Nessman line, Solidago, it's for acute bladder and or UTI type conditions. So that would be something that you would be looking for as well, is getting to whatever the root cause that would be causing the blood in the first place and addressing that. Okay, and so for webinars that we've recorded in the past, what you need to do is go onto the Biomed, so it's www.biomedicine.com website, and under the Education tab, there's a Webinar tab. So you would click the Webinar tab, and then there's Archives. And so you can click on the Archives, and you can see all the different webinars. We always record our webinars and then have them available to listen to. You'd have to sign in to be able to listen to them, so that would be using your customer code and then either your postal code with no space or your zip code as your password. And then you can go in and listen to everything that way. Okay, well, with that said, thank you, everyone. Thanks for joining the webinar tonight on Sanukehls, Botanicals, and Nutraceuticals.
Good evening, everybody. Have a fabulous night, and we look forward to seeing you in future webinars.
Okay, good night, everybody.